Hi everyone, my name is Allison Warren. I'm the Multimedia Public Relations Specialist here at Sarasota Memorial Healthcare System. And we have some pretty exciting news, and joining me to talk a little bit about it is the Executive Director of Behavioral Health Services, Terry Cassidy. Terry, thank you so much for being with us.
My pleasure. Very exciting news today.
So can you tell us what the exciting news is?
I sure can. I'm just dying to tell everybody. The hospital board today approved a $65 million project to build a brand new behavioral health pavilion, which is going to house inpatient psychiatric services and also outpatient counseling and behavioral health services.
Can you talk about why this is so needed for the behavioral health team?
Yes. Well, we recognize we worked very hard on a strategic plan, and we recognized that in this community, there was a tremendous need for behavioral health services, and we wanted to make sure we had a continuum, a very comprehensive continuum, offering the most intensive services and also all the way to community-based education, so the full continuum. And we wanted to house as many of those services in one building as we could. Now, our inpatient psychiatric facility is very old. I guess in Florida, being built in the 1970s is pretty old. And the building is, well, it's seen better days. And it was never really designed for the population we're serving now. So we're looking at having just beautiful state-of-the-art facility that's very warm and is really based on recovery and aesthetically pleasing and with behavioral health design in mind. And that goes to acoustics, goes to the features, it goes to how the rooms are configured. So we want to make sure right now people share rooms, patient rooms. Everyone's going to have a single room. So patients coming in, whether it's with depression or bipolar disorder, whatever's going on for them, they're going to be treated with the utmost dignity and respect and be brought into this facility where comfort and healing and recovery is promoted from every feature, from the staffing and our wonderful staff to the building itself. And then we're also going to have the outpatient services in the building, which is wonderful because it's going to be a 3-story building. And on the first floor will be all the outpatient counseling services. And so when somebody's leaving a higher level of care, they can be taken downstairs and toured and meet the staff and get acquainted with the facility and be more engaged with coming and getting aftercare services, which that demonstrates usually people have much better outcomes when they go to the next level of service as opposed to just leaving an inpatient facility without any support services. So it's also going to be very good for our providers here. Our doctors will be able to go from inpatient to outpatient, as will the counselors, the therapists, the addiction specialists. So it's just we're very excited about this.
What does this mean for your patients' recovery when this new state-of-the-art facility will be ready in 2023?
Sure. Well, I think the whole community knows SMH is really the center of excellence from everything we do here. We just 5 stars in so many areas, and patients coming in, the first thing they see is the emergency department and warm and inviting, and then even our discharge lounge. I remember when our accreditation body was here and they were like, oh my God, this looks like the Delta Sky Club lounge. And it just really gives a message to patients coming in that, we care about you. You're here for health and healing, and you're trusting us to take good care of you, and we're going to do that. So it really sends all kinds of messages. But it also, beyond that, when individuals are coming in and they're depressed or they're sad or they're maybe having a psychotic state, the environment can really facilitate so much. And so we've looked at all the evidence-based recommendations concerning behavioral health design. We've actually gone across and we've toured facilities across the nation to look at what's going on right now, and we're bringing that back to be innovative and state of the art and right on the cutting edge of what needs to happen to really promote recovery.
And how you kind of touched on this as well, but talk about how important it is to have that inpatient and outpatient treatment in the same facility, both for the patient and for the provider.
I sure will. It's It's huge. When a patient comes into maybe inpatient psychiatric services first time, and many people out there can probably understand this. When you're at that point where you need that sort of help for a loved one, it's frightening, it's scary, you're feeling out of control. And so that first impression is everything. And if you go into a facility and it's warm and it's pleasing and the staff just are welcoming and so expert in what they're doing and with kindness and compassion, then you have that rapport established with the therapists, the counselors, the physicians, the nurses and doctors. And now we know you're going to have a much better outcome if you step down to a next level of care, which would be perhaps even a partial hospital program, which is 5 days a week for 5 or 6 hours a day. Or it might be just counseling weekly, or whatever service you need to step down to. You already have a relationship established with individuals in this building. You know where it is, you're familiar with it, you know you feel safe here, you know you're going to get good care. So it's much easier to engage the patient in the next level of care and say, hey, let us introduce you to the individuals that are in this program that are going to help you. And give them tours. They know where it's located, they know how to access it, and they know a lot of the providers. So it's going to be paramount to having individuals continue the next step of their recovery.
How does that differ from what's happening now for patients?
Well, we didn't have outpatient services at all for behavioral health up until recently. And so we got those going back in December, and that was the partial hospital, which is really like a day program for short, intensive time frame, maybe 2 or 3 weeks. Again, 5 days a week. So if someone leaves an inpatient facility, they're here short time, maybe 3 or 5 days, and then they can be stepped down to the partial level of care where now they can go home every night. They can have their weekends, but they're here Monday through Friday. And if they don't need that level of care, they can go to the intensive outpatient services. So we hadn't had these service offerings up until December. However, we could not locate it in the same building. So it's in another area of the campus. And what happens now is we have to, we don't have that continuity as far as we provide them the directions, the address. Sometimes the staff from that program can come over here and meet with the individuals. The doctors have to walk in between, and sometimes that can be a little time consuming, 10 minutes there, 10 minutes back. So to have it all in one area is going to be just so beneficial all the way around.
What do you want the community to know about this? I mean, so many people are impacted by mental health issues. How important is it to have a new state-of-the-art behavioral health facility right here in our community?
Sure. Well, we know the statistics demonstrate 1 in 5 people have a mental illness. So 20% of the population. And now with the pandemic, I just read a Kaiser Family Foundation report yesterday that's demonstrating individuals, because of this pandemic, almost 50% of Americans are suffering some mental health distress because of this pandemic, whether it's stress, anxiety, depression. There's so many things are happening. So we know behavioral health needs are huge. It impacts everybody. And for so long, it was really kept kind of in the closets, in the shadow. There was so much stigma attached to it that people didn't want to talk about it. It was like what cancer was back in the 70s. People didn't want to talk about it. They whispered the C word. Well, individuals now are starting to really talk about it. With the pandemic, you're hearing mental health and mental illness more than ever because so many people are impacted. So the hospital and the leadership here and the board really recognize that there's a tremendous need in this community, and these services, we need to have it in place so that we can really fully serve the community and provide what's needed here.
Great news, such exciting news. Thank you so much for taking time to share this information with us, and we're so looking forward to continuing to update the community on the progress. When can they expect to start seeing work done?
Okay, from my understanding, now that we got the go-ahead and the approval and the funding, is we're going to now get into the design and development stage. getting the site ready, and hopefully shovels in the ground about this time next year with an anticipated opening date of October of 2023. So very excited.
Very exciting. And time is going to fly now that we have the board approval and we can move to the next step. So thank you again, Terry Cassidy, and to the community. We'll continue to keep you updated, and you can always check smh.com/news as well to get the latest information. Have a great day.